Who's this? Mangla Gulati, Vice President, Chief Quality and Safety Officer. So my job is to make sure that we're providing the highest, safest quality care to all of our patients all the time, every single time. Quality and safety is making sure we provide the best care to all of our patients and making sure that we're keeping not only our patients but also our associates safe all the time. Quality is measured in different ways. You can think about hospital-acquired infections. You can think about how long a patient waits in the emergency room to get to an inpatient bed. You can think about quality and making sure that patients get the right meals at the right times. And then safety is making sure that we don't unintentionally cause any harm to our patients or our associates. My career began as a hospitalist, that's taking care of patients that are admitted to the hospital. Somehow I was that person that kept saying, well, this doesn't work, why do we do this way? And then my bosses would say, well, do you think there's a better way to do it? How do you think we should do it? And slowly my role kind of evolved a little bit less from the clinical arena into quality improvement and safety. Before coming to MedStar Washington Hospital Center, I was the Chief Quality Officer at another healthcare organization. Interestingly enough, I did my internal medicine residency training at another MedStar health facility, MedStar Union Memorial Hospital. I came back to the MedStar health system, specifically MedStar Washington Hospital Center, really just because it delivers such great care. It has a great reputation in safety and quality, and just wanted to be part of this system. Wow, the best part about my job is I get to work with great people who are out there taking care of our patients every single day, learning from them every day, seeing how they're just so passionate about their work, and just every day trying to problem solve. The most rewarding part of my job is making improvements, making systems stronger and safer for all of our patients and for our associates who work in the healthcare system. I have never really been a dog lover. We did have a dog a few years ago, and she and I had we understood each other. And then about 18 months ago, we adopted a little puppy. He's a mini golden doodle named Milo, and now my whole life revolves around him, to the point where people who knew me with my first dog find it very hard to believe. My parents were immigrants from India to England. I was born in England, I grew up in England, and I went to school in England. My first job was working in a newsagent's in London. The newsagent is kind of the corner shop where people would stop by in the morning to pick up their daily paper and usually a pint of milk. Also, I did paper rounds where I would get on my bike and go to people's houses and drop off their morning newspaper. I came over to the United States about 25 years ago. My husband and myself, we came over, and initially we were up in Albany, upstate New York. I try to go back to London as often as I can. My family is still there. Family continues to be my inspiration and continues to keep culture at the very core of who we are. I love to go back to India whenever I can. In fact, I love to travel to any place whenever I can. I've camped in the Sahara Desert. I have stayed in a tree house in the Amazon rainforest. And when I say a tree house, I mean a real tree house up in the canopy of the forest where you'd wake up in the morning and there'd be a howler monkey peeping in at you through the mosquito netting. Although I've only been at MedStar Washington Hospital Center for a short period of time, I just love coming to work every day, seeing the passion that all of our associates have. It's been a great experience for me, and I look forward to the next 10 years.